she was even more concerned. There is a tremendous reluctance, even among immigrant parents raising U.S. citizen children. There's a lot of fear surrounding the public charge rule, especially because immigration courts have remained open, creating a strong impression that removal proceedings trumps public health concerns. On Thursday, Democratic lawmakers pressured Ken Cuccinelli, acting Deputy Secretary for the Department of Homeland Security, to suspend or disregard the rule during the virus outbreak. Cuccinelli said public health exemptions written into the rule already addressed that issue. U.S. Representative Pramila Jayapal from Washington said the rule scares away people from seeking care, posing a public health risk for everyone. She tweeted after the new statement on Friday, quote, "This is a huge win for immigrants, public health, and everyone," end quote. My skepticism remains on that one, but we'll see how that turns out. All right, our next article, once again about the coronavirus, is entitled "Coronavirus Epidemic Brings Special Challenges for Immigrants in Urban Areas." Now, we talked a little bit about this a few shows ago, but this is a big problem for everybody living in urban areas, but a lot of immigrants in particular live in these areas. And so they face their own special set of problems above and beyond what other just residents of these areas are facing. So the article reads as follows. Immigrants in urban areas face particular challenges during the coronavirus epidemic. They are more likely to live in crowded housing and use public transportation. Both factors can make them more susceptible to infection. They also tend to have lower incomes than native-born workers, and studies have shown low socioeconomic status can lead to adverse health outcomes. In New York City, immigrant nonprofit organizations are conducting outreach as the threat of the virus grows. On a recent weekday morning in March, about a dozen immigrants and translators gathered at the headquarters of the African Services Committee in Harlem. Franco Torres, head of the legal services, welcomed them. He advised them on how best to contact immigration courts about rescheduling their appearances if they felt ill. Then Prashant Putaguta, a health outreach worker, spoke. "If you work and are able to work from home, we recommend you do that," he told them. If that wasn't possible and they felt unwell, he told them they could wear a mask and inform other people they were feeling sick. One of the attendees, who asked to be identified as M, because she doesn't want to jeopardize the asylum application she's filing, said her work had come to a standstill. She freelances in the textiles industry, and all of her clients had canceled appointments. "Financially, I'm worried. Immigration-wise, I'm worried," she said. "There are so many things to be worried about, plus this thing comes along." Kim Nichols, the co-executive director of African Services Committee, says many of their clients work in restaurants or as home health care aides. They live paycheck to paycheck. They don't have any resources to back up finance in the event they're sick, she says. "We are very concerned people are working when they shouldn't be." Nichols said her organization hopes to provide testing for the virus in the weeks ahead. That's in part because many immigrants, particularly those who are undocumented, may not feel comfortable going to hospitals. A few blocks from African Services, a Honduran immigrant stood in a McDonald's with her son, who is in second grade. She asked to be referred to by her first name, Yvette, because she's undocumented. She said most of the information she's received about the virus has come from Facebook and from her son's school, which closed on Monday. If her son becomes sick, she said she would take him to the doctor. "I'd take him immediately," she says. "I wouldn't wait a second." But if she gets sick, she's not sure. There would be the question of how she could pay. She hadn't heard that New York Mayor Bill de Blasio has said that residents could be directed to city facilities that would treat them irrespective of their immigration status or whether they have insurance. Nadia Islam, an associate professor at NYU Medical School, says that in order to counter the coronavirus, policymakers need to think beyond providing health care. Unless we create a healthcare system that's supportive by doing things like providing paid sick time, making insurance very accessible, she says, the risk to the public is greater and it just contributes to the potential spread. These are not new issues, Islam adds, but the way existing policies impact immigrant and the broader community are becoming more evident in the era of the coronavirus pandemic. All right, moving on. Our next article is entitled, Immigrant Detainees in Massachusetts Are Fighting, there's a cord wrapped around my foot, are fighting to be released in the pandemic. And this is another problem we talked about a couple of shows ago. As most of the country remains in lockdown to curb the spread of coronavirus, nearly 150 immigrants are fearing for their safety as they fight for their release from the North Dartmouth, Massachusetts detention facility. From the few hours of television news they can watch each day, the detainees have learned that social distancing, along with proper sanitation, is the only way that they can protect themselves from infection. But that's all but impossible at the Bristol County Correctional Center, where the detainees are held together in tight quarters without the protective equipment or sanitation resources necessary to protect themselves, they argue in a class action lawsuit. They are among the 38,000 immigrants in detention across more than 130 private and state-run detention facilities nationwide. As of April 7th, 19 detainees across 11 different facilities have tested positive for the virus, none of them in Bristol, though advocates say it's only a matter of time before it hits or testing rates improve. Only after outcry from immigrant advocates did U.S. Immigration and Customs Enforcement recently institute national policies encouraging social distancing in its facilities and provide soap, hand sanitizer, cleaning supplies, and personal protective equipment. The agency also announced Tuesday that it would start releasing detainees who are medically vulnerable to COVID-19, the disease caused by the coronavirus. It has released 60 so far, and has identified another 600 who would qualify. But that's only a fraction of the detainees nationwide. Unless the agency starts releasing detainees by the thousands, that means most will remain in confinement, despite the fact that they largely have no criminal history. There is, therefore, a national advocacy push for the administration to alter its enforcement priorities to release all detainees, or at least those who haven't committed serious crimes. While immigrant advocates campaign for their release, even in the best of times, their message has become even more urgent amid the outbreak. In the meantime, those at Bristol remain in conditions that they fear could facilitate the spread of the virus, which can be carried by those who don't exhibit symptoms. For the more than 30 detainees with underlying medical conditions that make them vulnerable to complications from COVID-19, it's an especially scary situation. So far, only 18 detainees have been ordered released as part of the lawsuit, and not all of them qualify as high risk. We suffer from being separated from our families and loved ones, 47 detainees wrote in March 20th declaration. To add on top of this, we are now living in fear. As of April 9th, there are over 16,700 coronavirus cases throughout Massachusetts, including in the Bristol facility. A healthcare provider in the facility has tested positive, according to county officials, and the detainees claim that 2 correctional officers showed up for work with symptoms of the virus, including high fever. Nevertheless, Bristol County Sheriff Thomas Hodgson has argued that freeing the detainees would only put them and the public at greater risk. He claims there isn't an adequate social safety net right now to facilitate detainees' return to society, and they would receive better health care and custody than they would in the outside world. Quote, I'm deeply troubled by elected officials suggesting that we release inmates because of coronavirus, he tweeted. This would present a huge public safety and public health risk to the communities and the inmates themselves. The detainees maintain that they can't protect themselves from the virus inside Bristol. While the facility is operating at just below its normal capacity, Bristol is housing far too many detainees to be able to enforce social distancing. ICE has nevertheless continued to place new detainees at Bristol, and at least on one occasion, without even administering an initial medical checkup, potentially exposing the rest of the detainees to the virus. The detainees' living quarters are largely an open plan with no real privacy. Their bunk beds are spaced just 3 feet apart, and the dining tables just inches, far from the minimum 6 feet of distance recommended by the Centers for Disease Control and Prevention. They share a small, poorly ventilated room where they watch movies, access the computer, and hold religious services. Correctional officers have started telling detainees to take their food trays back to their beds to eat, but even then, they're still in close proximity. Detainees who exhibit symptoms of the virus have been put into solitary confinement without adequate medical care. Vanessa Suarez, a deportation defense organizer at the Connecticut Bail Fund, said. While correctional officers and health professionals wear face masks and gloves in the solitary confinement area, where they might come into contact with people who could be infected, they don't wear the same protective equipment in other areas of the building and could potentially expose other detainees. The detainees also have little resources to practice good hygiene. At the outset of the lawsuit, which was filed in mid-March, multiple showers and urinals were out of order. Detainees tasked with cleaning their quarters don't have access to bleach or other disinfectants, just diluted soap. The facility has started wiping down hard surfaces where the virus can survive for days and providing hand sanitizer, but that's little comfort when the disease can so easily spread through respiratory droplets, which are expelled through coughing, sneezing, and even breathing. What's more, correctional officers haven't seemed to appreciate the severity of the threat of the virus, telling detainees that it is nothing more than the flu and communicating little information about how they can help prevent its spread. Some detainees have organized a work strike in protest of the conditions. The lead organizer was temporarily placed in solitary confinement, where he was unable to communicate with the lawyers working on the detainees' lawsuit. His lawyers claim his placement in solitary was retaliatory, though the county disputes it. Others remain afraid to speak out, Suarez said. Everyone is very much afraid of being punished for speaking out, but they're also very aware that their silence will lead to their death, she said. Speaking out has always been a fear that those in incarceration have, and for people who have a pending immigration case, it's so terrifying how much they're putting at risk. These immigrants aren't in detention because they've been charged with a crime. Rather, they're accused of civil immigration violations, such as overstaying a visa or residing in the U.S. without authorization, and they have been detained while they wait for the outcome of their deportation cases. Some may well be allowed to remain in the U.S. eventually, depending on what an immigration judge decides. The federal government has significant discretion to determine who it subjects to this kind of civil detention. Toward the end of Barack Obama's presidency, he prioritized only those immigrants who had a record of committing serious crimes, releasing others into the interior of the U.S. Under that system, most of the immigrants in detention at Bristol would have been released. Among the 147 detainees, at least 111 of them have never been convicted of a violent crime, and 56 have never been convicted of a crime at all, according to Lawyers for Civil Rights, the legal aid group representing the detainees in court. But President Trump, by contrast, has sought to detain any unauthorized immigrants anywhere in the U.S., even amid the pandemic. Lawmakers and advocates have been calling for their release, especially for detainees who are older or have underlying health conditions that make them more susceptible to the virus, including those with compromised immune systems, diabetes, and heart disease. Although ICE has released a small number of detainees suffering from autoimmune disorders in places where detainees have tested positive, more must be done. ICE should release certain detainees, those who pose no threat to public safety or national security, on their own recognizance or into alternatives to detention, Democratic Representatives Gerald Nadler and Zoe Lofgren wrote in an April 17th letter. The American Civil Liberties Union and the Northwest Immigrant Rights Project have already sued ICE to seek the release of vulnerable detainees at one detention center in Tacoma, Washington, just outside Seattle, the epicenter of the U.S.'s first outbreak of COVID-19. But the detainees in Bristol are going even further, calling for the release of all detainees in a first-of-its-kind class action lawsuit. Unlike in other cases, the judge has ordered the humanitarian release of immigrants who don't have medical risk factors. We don't have control over a lot of things right now, but we do have control over who we choose to protect, Suarez said. What we've asked for is that we do protect the lives of those who are incarcerated. Everyone deserves the opportunity to survive this. And while this brings up great points, and I'm not disputing any of this, I would like to point out a lot of what I've read revolves around, not just here, but just in general lately, revolves around people who are dying of this virus. But that only encompasses a very small number of people who are affected by the virus, both in terms of what we're doing to avoid it, obviously, the loss of jobs, the social distancing thing, all that sort of thing that's going on right now. It's affected everyone's life in one way or another. But also, if you get sick, for one thing, it's a very nasty thing. The number of people who have died from it is a very small percentage of the number of people who have been hospitalized for it, which is a serious thing. I mean, if you go to the hospital, that's a big deal. If something happens to you and you end up in the hospital, that is a big deal. And that is not a small thing to happen in your life. I mean, it is a big event. But even then, the number of people who have been hospitalized is very small compared to the number of people who have been sick. And when you're sick with this, it's generally for a long time. It's not just, 24-hour flu and you're like, oh, I feel better. Boy, I was sure sick yesterday. It's like weeks of being ill. And so even if people weren't losing jobs and social distancing and all these different kinds of things, you would be home in bed for a while. And that's even a small percentage of the people who are connected to people who could be at risk. Now, a lot of people, we're finding out this is a very strange illness in terms of like who it affects and how it affects it. And to a certain extent, we know like older people and people with pre-existing conditions are vulnerable, but a lot of young people are dying too. And it's young, healthy, they're just out of nowhere for some reason. This person, they feel kind of icky for a while and then they're okay. And this person just goes straight downhill and dies. And it's not necessarily old people and people who are already ill who are dying from this or who end up in the hospital. So all the rest of us who don't fall into any of these other groups, who may be only slightly at risk or who may only have had mild symptoms, are concerned for all of the other people that could be victims of this disease. So it is affecting everyone in all sorts of ways. And it's not just, we can't just look at deaths as a metric for how we judge the severity of this thing. This is a serious illness in that it affects everybody in some way or another, both directly when you get it and indirectly in trying to help flatten the curve, as they say. So we have to be aware of this when we think about when we talk about it, and I'm just aside from immigration stuff, this is just generally something we all have to be aware of, because even if, let's say, the number of deaths turns out to be fairly low in the grand scheme of things, if you count each of these other groups and the serious effect that this has had on them, the hospitalizations, the people who've been really ill for a while, and so on and so forth, this has been a very, very serious disease, and its effects have been profound. And until or unless they come up with a cure, it's going to remain that way for a long, long time. So we have to be aware of this. Everyone needs to be aware of this. Drink more water, too. It won't necessarily help you with the disease, but it'll help you keep talking, and when that's your job, and that is my job here. Okay, this is from the UK. Okay, this is from the UK, but there are some similarities with what's going on here in the US, so I thought I would read it anyway. It's entitled, UK Presses Ahead with Points-Based Immigration Plan Amid Pandemic. A move by the UK government to press ahead with its plan for a new post-Brexit points-based immigration system has been slammed by critics as out of date with the economic realities exposed by the coronavirus pandemic. New guidance issued by the Home Office on Thursday clarifies officials' plans, first revealed in February, for transforming the rules governing those who can enter the country to work from the beginning of 2021. The Guidance for Employers document reiterates that under the new system, visas will be awarded to individuals on the basis of their specific skills, qualifications, salaries, and shortage occupations. This represents a significant change for employers in the UK who will need to adapt, the Home Office document says. The new system will treat EU and non-EU citizens equally and transform the way in which all migrants come to the UK to work, it adds. Home Secretary Priti Patel has previously said the new immigration policy was aimed at attracting the brightest and the best to the UK. However, under the plan, there will be no specific entry route into the country for so-called low-skilled workers, the likes of whom have been thrust to the front line of the coronavirus outbreak in recent weeks as delivery drivers, farm and supermarket workers, home care assistants, hospital porters, and cleaners. The Home Office document says specific initiatives for National Health Service workers are in the pipeline, as well as for scientists and graduates, with foreign nationals making up more than 13% of the NHS workforce. But critics of the point-based scheme say it fails to account for the need for workers from abroad to fill essential jobs in an array of other sectors, and threatens to result in widespread staff shortages. Moreover, they argue, the impact of coronavirus in revealing the critical importance of so-called low-skilled workers throughout the UK is reason enough for the entire plan to be scrapped. It is becoming more and more apparent that the immigration system, as it was designed and published weeks ago, is just not fit for this economy, says Sophia Walpers, a Brexit and immigration policy specialist at the not-for-profit business advocacy group London First. The coronavirus crisis has shown how many of the roles deemed to be lower skilled are vitally important to the UK economy as a whole, she added. Citing the example of workers in the food processing and logistics industry, as well as the home care sector, Walper said the deadly COVID-19 pandemic had put such positions' value into the spotlight. Foreign nationals currently make up about a sixth of England's 840,000-strong care sector workforce, while some 20% of workers in the UK's agriculture sector come from overseas. Right now, they are some of the ones working hardest to make sure we all stay alive, Walpers said. So the Home Office publishing the guidelines for employers today is really putting the emphasis on how out of date their thinking is regarding what the economy really needs. Tom Hadley, Director of Policy and Campaigns at the Recruitment and Employment Confederation, meanwhile, called for officials to rethink their plans and review what jobs are the most important in British society. It's a good time to refresh the underlying assumptions that actually underpin a lot of the government's plan on immigration, Hadley said. It's a blunt instrument to talk about the brightest and the best, he added. From carers and cleaners to retail workers and drivers, the current crisis is showing us how much we depend on people at all skill levels. And I might point out that we have the same situation here in the U.S., and in a more general sense, this experience is really showing us how much we depend on people that do what we tend to call low-skill jobs. Low skill in the sense that maybe it doesn't take years of education or complex training in order to do these jobs, but they are very important. For example, grocery store. It doesn't take a whole lot of education to stock shelves, but somebody's got to do it. And when you go to the store and you want to get some food, there's only food on the shelves if somebody's putting it there. There's only food in the store if somebody's delivering it there. There's only food being sent if somebody's growing it and harvesting it. So all the way down the line, you have armies, whole armies of people in these low-skilled jobs that are doing the work that is keeping us all alive right now, that's keeping us fed, that's keeping us healthy, that's keeping us safe. And these people, in the meantime, are not so safe. They are not necessarily in safe conditions, and they are not being compensated in any way for the risks that they're taking. So all in all, we really need to rethink how our notions of hierarchy. Certainly, there are some jobs that require, like a doctor, for example, is a job that requires a lot of training, years of education and practice before you're qualified to do this work. That is very important work, and it should be compensated appropriately because it is important work. But it is no less important to do all the things that, from cleaning to carrying things, to stocking things, to growing things, to picking things. All those things are also important. All jobs are important. All work is important. All people are important. All workers are important. And it is important that we, important, I'm using that word a lot, but it is really vital that we recognize this and take a fresh look at how we treat people and how we value what they do. And I have run out of time here. I thank you for joining me for CU Immigration here on WRFU and UPTV. And I hope that you can stay well, and we'll see you soon. Bye-bye.